A very important topic, that is VSUP score charting in the gynecology. How we will measure the VSUP score? So in VSUP score, if the final score you will get between 0 to 5. So what does it signify? Your body is not prepared for labor and it is not likely to start naturally. It won't start. If VSUP score is 6 to 7, you may or may not have successful induction. You may or may not have successful induction. Your doctor will need to make a judgment. If the score is 8 to 13, the labor will probably start soon. If you are induced, you are likely to be able to have vaginal delivery. So look at once more. 0 to 5, the body is not prepared for labor and it is not likely to start naturally. For 6 to 7 score, you may or may not have successful induction. Your doctor need to have a judgment plan. 8 to 13 labor will start soon. You will be induced. You will likely to able to have vaginal delivery. This is the significance. Now let's begin the topic. Introduction. Induction of labor is common in obstetric practice. Induction have to be done. According to literature, a rate varies from 9.5 to 33.7% of all pregnancy annually. Annually, 9.5 to 33.7% patients have to be induced. In the absence of a ripe or favorable cervix, if cervix is ripening is not happened and not favorable, successful vaginal birth is less likely. Therefore, cervical ripening or preparedness for induction should be assessed. So cervical ripening and preparedness for induction should be assessed before regimen is selected. Assessment is accomplished by calculating a VSUP score. When VSUP score is less than 6, it is recommended that cervical ripening agent VSUP score less than 6, it is recommended that cervical ripening agent be used before labor induction. Labor induction से पहले have to use cervical ripening agent. Okay. So doses. So what is the dose? Cervical ripening and induction at term. Cervical ripening and induction at term. The baby is term now. Misoprostol. Misoprostol is given vaginally at 24 microgram every 4 to 6 hours. Every 4 to 6 hours, 25 microgram is given. Cervical ripening. For cervical ripening at term, misoprostol given vaginally at a dose of 25 microgram every 4 to 6 hours. Every 4 to 6 hours, 25 microgram. Orally at 20 to 25 microgram every 2 hours. If won't give upper vaginally, then orally 20 to 25 microgram every 2 hours. Every 2 hours we have to give 20 to 25 microgram. With dinoprostone usually 12 hours. With dinoprostone usually 12 hours should be allowed for cervical ripening, after which oxytocin induction should be started. So with dinoprostone usually 12 hours should be allowed. Give 12 hours for cervical ripening, after which oxytocin induction should be started. What other side effect? PGE1 and PGE2 have similar side effect and risk profile, including fetal heart rate deceleration, fetal heart rate get decreased, fetal distress, emergency cesarean section, uterine hypertonicity, nausea, vomiting, fever, diarrhea, vomiting, and peripartum infection. Once more, the side effect is including fetal heart rate deceleration, fetal distress can occur, emergency cesarean section, uterine hypertonicity, nausea, vomiting, fever, diarrhea, vomiting, peripartum infection can occur because of this. So pre-induction cervical assessment, how you will do pre-induction cervical assessment? It is known that success of labor induction is closely related to ripening of cervix. It is known that success of labor induction is closely related to ripeness of cervix. Various scores have been proposed to evaluate the cervical status. So how we will see Bishop score? This was proposed by Bishop in 1964 and is most widely used score. It was originally proposed to determine the suitability of a patient for induction of labor in patients who were parous at term and had uncomplicated pregnancy and the fetus was in cephalic presentation. Bishop score was proposed by Bishop in 1964 and is most widely used score. It was originally proposed to determine the suitability of patient for induction of labor in patients who were parous at term, had uncomplicated pregnancy, and the fetus was in cephalic. Now Bishop score. A score of 8 or greater is considered to be favorable for induction. You can do induction. Our chance for a vaginal delivery with induction is similar to a spontaneous labor. A score of 6 or less is considered to be unfavorable and therefore need for cervical ripening agent like prostaglandin and non-pharmacologic method like amniotomy. So this is a modified Bishop score. Modified Bishop score. A dilatation of cervix, consistency of cervix, length of cervical canal in centimeter, position of cervix, and station of presenting part. So dilatation of cervix in centimeter, if 0 you will say score is 0, 1 to 2 centimeter score is 1, 3 to 4 2, and 3 5 or more centimeter. For consistency, firm consistency, we will give a score 0, medium 1, soft 2, and none is 3. And length of cervical canal more than 2 cm 0, 2 to 1 cm 1, 1 to 0.5 2, and less than 0.5 is 3. Position of cervix posterior 0, central 1, anterior 2, and none is 3. Station of presenting part -3 0, -2 1, -0 to -1 to 0 2, and below spines. So these are the modified score. So modified score on smart cervical dilatation 0, 1 score for 1 to 2, 2 4 3 to 4 centimeter, and 5 to 6 for 3. Cervical length more than 4, 3 to 4 1, 1 to 2 2, and less than. Consistency firm 0, medium 1, soft 2. Cervical position posterior than 0, central 1, anterior 2. Station centimeter in relation to spine 3 or above 0, 2 above spine 1, -1 0 spine 2, below spine is 3. Total score 13, 0 to 5 favorable, 0 score, 6 to 13 unfavorable score. So bishop score been modified severely since then. One of such replacement of replacement with cervical length in centimeter with a score at 0 for more than 4, 1 for 3 to 4, 2 for 1 to 2 centimeter, and 3 for less than 1. Cervical length may be easier and more accurate to measure and have less inter-examinability. So this one is the modified score. In modified score, bishop score is 0, dilatation 0, then score is 0, cervical length 3 centimeter 0, station -3 0, consistency firm 0, score position posterior 1 is given for 1 to 2 centimeter, 2 for cervical length, -2 for station, -2 for 2, medium consistency 1 score, mild position 1, 2 is 3 to 4 centimeter, and more than 4 centimeter 3 score. Cervical length is 1, then 2 score, less than 1 3, -1 station or 0 2, plus 1 2 3 3, consistency soft, then 2 score, position anterior 2, score more than 6 successful for induction of labor, less than 5 unfavorable for induction of labor. Cervical ripening is essential. So this much is for this modified bishop